Do we have 19 more than yesterday?
Okay, hello everyone. This is the May 7th news briefing from the Champaign County Joint Information Center. We have a few speakers for you today. I know Mayor Charles Smith from Rantoul also intended to be here, and we know he was on a call right before this started, so that's why we took a couple of minutes to get started there. So he may pop in, but per usual, we're going to start with Julie Pride from Champaign-Urbana Public Health. She's going to give us some local updates.
Hi, today's numbers are, we have a total of 236 cases, up from 217 yesterday. And the outbreak at Rantoul Foods is now up to 52 confirmed positives in employees there. That does not take into account the community spread from that. That has not been, well, that's still being investigated. And we also know that starting tomorrow, there's going to be a lot more testing going on up there. SafeWorks will be up there with OSF, and we believe that only around 200 of the 700 employees have been tested thus far. Thanks.
Okay, thank you, Julie. Next, we're going to go to Sheriff Dustin Harmon.
Thanks, Pat. Thanks, everyone, and welcome.
Yep.
First off, I just wanted to say thank you to everyone who's been complying with the executive order regarding masks and facial coverings. Just based on what I've observed so far in the community, it seems like we have a high level of voluntary compliance, and that's exactly what we've been looking for all along. I also want to be really transparent about what the executive order means to law enforcement, as there continues to be some different expectations out there about what police should be doing to make sure our community members are following the rules. It's not the intent of local law enforcement to go business to business to make sure everyone is wearing a mask. We've also said before that it's not our intent to go house to house to enforce social distancing. To be completely honest with you, there's not even really a good enforcement mechanism to do so, in my opinion. What we've been saying all along is that the intent of the executive order is not to punish people for noncompliance. Rather, it's to encourage people to voluntarily do what's best for our whole community. We're asking adults to make adult choices. By not wearing a mask, or by having people over to your house for a backyard barbecue, we have the potential to do really harm to others in our community. I'm asking for our community members, not just as sheriff, but by somebody who lives in this community as well, hold out just a little while longer. I'm anxious to get back to the sense of normalcy just like everybody else is. But right now we need to stay at home, wear a mask when we go out for essential trips. It's getting harder and harder. I realize that. Every day the sun is shining, every day it's warm outside. It's harder and harder to stay at home to make those non-essential trips. But we truly can save lives the longer we hold out. Our community members in Champaign County, and frankly Americans across the country, have a knack for coming together and supporting each other in times of crisis. And that's what we're continuing to ask of you now. Wait a little bit longer. Let this wearing a mask be our rallying cry and saying we support a healthy environment. We'll get through this, and then we'll be back to some sense of normalcy as soon as we can.
Okay, thank you, Sheriff. Next, we're going to go to Sarah Michaels. She's with Environmental Health at the Champaign-Urbana Public Health District. And we wanted to, obviously with the elevated number of cases in Rantoul, we wanted her to talk a little bit about sort of the general process for what public health does when they become aware of a situation like that. So we'll go to Sarah now.
Okay, so basically what I did was have a checklist of things to look for when I did a site visit. So those types of things that I looked for was whether the facility was evaluating all the areas for social distancing. Those include break rooms, cafeterias, and any shared spaces. And then making sure they addressed the staggering of shifts, start times, and break times to prevent congregating. And then reduce production line staffing to the extent feasible to minimize the close worker contact. And then designate entrances and exit, maybe one for each, so that you don't have people congregating in one area as well. Mark distances 6 feet apart where workers stand in line while waiting to clock in and out, conducting health assessments, waiting for transportation, or other areas that they congregate. And then, of course, facilities should be, and we were making sure they were providing employees with the necessary PPE and replacing when necessary. And actually, not a recommendation, but requirement of staff to wear a mask and train those employees on how to properly wear the PPE and stress good hygiene. That's what we look for.
Okay, thank you, Sarah. And I see Mayor Smith from Rantoul has just joined us as well. So Mayor Smith, not to put you on the spot because you just got in, but if you could tell us a little bit about what Rantoul is doing to keep residents and workers safe.
Basically, we're getting notifications out, and we're also asking for volunteers to come out and work with us. We're trying to strategize a plan right now as to the total scope of this. And this is a little bit overwhelming. We're getting more information from Dr. Fletcher today about the facility in Rantoul. And so we're just now getting organized and able to face this issue. So it's a lot bigger, a lot more complex because of the population that we have in those facilities is mostly Hispanic or French, Honduran, that type of thing. I was speaking with different dialects. And also being able to identify the people that are actually infected because of HIPAA. We have certain constraints as to who are they, where do they live? Are they in Champaign-Urbana? Are they in Rantoul? Are they in other outlying areas? So this has grown exponentially into a huge problem right now.
Okay, thank you, Mayor Smith. So as always, we wanted to address your questions as well, give you the opportunity to ask us some questions. So as normal, I'll go down my list of participants here.
Okay.
And if you could just let us know what agency you're from, and if you could direct your question to a specific person to make it go a little more smoothly, we'd appreciate that. So Christine Herman, you have the floor.
Well, hi. So I guess this question is for Julie. As far as the situation in Rantoul is, so you're saying everyone who works at the facility is going to get tested today or tomorrow, and then also you're doing contact tracing for people, members in the community who live with employees and that sort of thing as well?
Yes. We don't do the testing. We do the follow-up, the contact tracing, isolation, quarantine, and case investigation. So we get all positive test results. So what is happening now is SafeWorks, who works up there in the plant, they are working with OSF, and they are going to start doing employee testing tomorrow. We have done, so what we did initially was we went up there with Carl to do the first day and did what were considered close contacts of the 2 cases that we had. We tested all of those and then gave testing slips for people to go through, for the employees to go through the various drive-through test sites that exist. So these are, we estimate around 200 have been through that so far.
And then you anticipate, as you've said before, 24-hour turnaround on those test results that will be taking place tomorrow?
That depends on, I still don't know what lab they're using. If they use a Quest or a LabCorp, they'll need to find out. I haven't heard back from Dr. Fletcher what lab they're using, what laboratory. So that will be the determination of that.
Yeah. Does there come a point wherein the facility will need to be completely shut down? How is that decision made? And is that something that would come from Champaign-Urbana Public Health in terms of a decision or a mandate?
Yes. So that already did happen at the very beginning. It was closed for the very first day we were up there, but for a short period of time. And the idea was to get the infection control protocol and procedures put into place. These have been around for a while, but they had not been implemented. So once they were implemented, then it was reopened. The thing that's important to know, testing does not, testing is only like a point in time picture of the situation. Testing everyone is not going to relieve the necessity of still continuing on with all of the things that Sarah just mentioned. That is going to have to continue on until we have a vaccine, basically. So those
You're
are
advising people who've been exposed to the confirmed cases to quarantine. Is that what you're doing? I know there isn't really enforcement for that. You're telling people to do that. Do you get the sense that employees are quarantining if they've been exposed and staying home from work?
Yes, I mean, they have a certain amount, they each meet with a case investigator and they're told how long they need to stay home. I know that at least a few are already back to work. So yes, that is being done. And we do follow up. We follow up every day with people that are in isolation and quarantine. Part of the issue, though, has to do with when you, if you're infected and you live in a house that's overcrowded, or a living arrangement that's overcrowded, there's no way to effectively isolate within that facility. So we do have some other options available for that, but this is not a short-term thing. This is going to be going on. This will be ongoing. So we just have to make sure that all the places, not just this specific facility, but any place when they start to reopen, make sure that all infection control measures are in place, and we'll monitor those periodically and try to help out and give guidance as we go. But this is something that this will be the key to keeping outbreaks down anywhere.
And is it accurate to say that Champaign-Urbana Public Health helps provide housing to people who can't, in a practical way, isolate in their current residence?
Yes. Well, if you mean during isolation and quarantine, yes. We have contracts with hotels, and we can, let's say someone tests positive and they live in a household with either, a lot of people where social distancing isn't possible, or if they live in a household where someone in there has a health concern, they're older, they have an underlying health condition or something that makes them more vulnerable, they also have the opportunity to do their isolation in a hotel.
Yeah. Thanks. I have more, but Patrick, you can circle back to me if there's time at the end.
Okay, thank you. Courtney Bunting, I have you next on my list.
Okay, I think the one that I had was, what can employees do who are still coming into work do to keep themselves safe, aside from what you were talking about when it comes to isolating in their own homes, but are there any other precautions that they can take to make sure they're personally staying safe?
Yes, the personal protective equipment is key. I mean, the masking, everyone has to wear the masks, and they have to wear them properly. That can cut down on transmission a great deal in an environment like that. So that's the main thing. Attention to hand washing and social distancing when you're not at the job. The issue with some jobs is they cannot be 6 feet apart. So it's to limit that. So if they're working on a line, for example, make sure the PPE is on at all times and they maintain as much as they can. And then once you get out of that situation, make sure you're doing the hand hygiene. Still continue to wear the mask if you are riding in a car with other people, and wear it anytime you cannot maintain social distance from people.
And then in terms of them interacting with the public, I know you talked about if they were to be quarantined. So I guess walk me through what happens whenever one of them tests positive, then they stay in their home until they recover from the symptoms, and then have the allotted amount of time without showing symptoms. Is it just like we talked about a while back, whenever it was so many days symptom free before you could return to work?
It is. I think that I would have to look exactly what it is, because some places that are considered critical or essential, they can have a little bit, it's a little bit different of a time. So I'm not exactly sure without looking what that time is, but it's roughly that. The sick individuals are placed in isolation. Persons who have been exposed but have not yet tested positive, or who are not positive, they remain in quarantine. So quarantine is for exposed people, isolation is for ill people. And frankly, what we're running into some is that by the time we have found out about cases, there's an entire household unit that's infected. And that's happened not just here, but a lot of places. If you have overcrowded housing, that's almost a given.
And the only other thing I have right now is if someone, you said that you're tracing the amount of cases that are throughout the entire Rantoul community. What stage are you in doing that? And then when could you possibly have a number, an idea of how many cases there are?
Okay, well, first of all, it's not just Rantoul. So this is important to know. People that work at the plant, this has created outbreaks, other outbreaks in Champaign and Urbana, Rantoul, and actually even some cases are outside of our county because the cases are counted where you live, not where you work. So not all, when you look at our charts, for example, on our website, and you can click on and see the different zip codes, not every case that's in Rantoul is associated with the plant, the Rantoul Foods, and not every case is even in our county. So so it's just important to know that they do that. But we do our contact tracing. That starts immediately as soon as we get the positive case, and we do this 7 days a week. So the contact tracing starts the minute we get the positive test results. We have a large group working on that.
Okay, you can move on from me. Thank you.
Okay, thank you, Courtney. Haiti Clotter, you're next on my list.
So I know Sarah had mentioned the staggering of shifts, designating maybe one exit or entrance for employees. So just to clarify, those practices, is that the only way a business can continue to operate when there is an outbreak?
Well, first and foremost, we want that social distancing to be met. And if they can't, then they have to be wearing the PPE. It's, the first and foremost, if you can have both, great. But if you can't get that, which some of those production lines you can't, then you have to wear proper PPE.
Okay, and then Julie, you said that as far as when monitoring Rantoul Foods, that basically will continue until there's a vaccine. Just kind of share, I guess, what that will even look like as far as monitoring Rantoul Foods.
Well, it's not just Rantoul Foods. I mean, that's just part of what we'll be doing during the pandemic is just to check with places, especially if we get complaints, we would follow up, but also just, being in contact with the managers up there and, seeing what kind of situations that we can maybe help with or something that might be coming up. So it's a lot of communication for this type of situation. So we will be working with basically any of the places that are opening and that have questions. But with places like this where there's really a potential for an outbreak, we will just be in more regular communication.
Thank you.
You're welcome.
Okay, before I circle back, because there's a few extra usernames on here that I'm not recognizing. So does anyone who hasn't asked a question yet have a question that they want to ask? And I'll give it about a 5-second count here. Okay, hearing nothing, I'll go back to Christine. Christine, we have a couple more minutes if you've got another question.
Yeah, Julie, you just mentioned that, if you hear complaints, you'll go in and check on businesses. Is that what people should do if they're concerned a place is not complying? They should contact public health, or do they contact, law enforcement? Where do you point people?
Well, if it's a situation like, for example, we have had businesses in our community in Champaign-Urbana that the staff aren't wearing masks, and we get a lot of complaints about that. Ideally, what you would do is talk to the management there and let them know that as a consumer, you would like people, not only the people coming in, but also the people working there, to wear masks to protect to protect everyone. So, the first thing would be to talk to the management of the place. And then if you need to, call us and we'll follow up and see if we can get them to implement that policy. And then it will go from there.
And then just a quick question about contact tracing. Have you had to make additional hires or bring more people into the contact tracing role because of these new outbreaks in the Rantoul area?
Oh, yes. So in normal times, pre-pandemic times, or when we're not in an outbreak, we have one disease intervention specialist, which is a name for a contact tracer, and then we have a backup, and then there's a couple that can fill in if needed. What we have now is we're probably up to 15 people doing contact tracing and doing case investigation, and then following up with the people that are in isolation and quarantine. And then we also have an entire staff that just answers questions on the phone all the time. Like I said, we're 7 days a week now, and we have, what we had to hire in specifically for the latest outbreak, we had to hire in quite a few very specific dialect translators. So we have them working with us as well. So we have had to hire additional staff, but most of the staff that we have doing contact tracing are staff from within our agency who we have moved into other areas.
And as other like non-essential or those elective procedures, you mentioned dental, maternal, child health, as those things start coming back online down the road, will the plan be to hire more people from outside of your agency to do the contact tracing that will continue to be needed? Yeah,
I mean, we literally evaluate this and assess this every day. It's based on a variety of things: how many outbreaks we're having, how many contacts we're having, how many what's going on out there that we have to do. So it is certainly possible that we will have to hire more at some point. We are hopeful that we will be getting some additional funding coming in to help with this, because so far we have not received any from the federal government or the state outside of a grant which we've been promised that will basically cover about, I believe, 2 weeks worth of the emergency operations center thing. So it's a little concerning that we're only a few months into this, and it's this expensive and no money has been coming in. That is concerning. But right now we're okay. The other thing that you have to think about is that, or we think about all the time, is that in normal times we have all kinds of other outbreaks as well. So we do not want to get any other outbreaks on that. Certainly the social distancing and the hand hygiene will help prevent that some. So we hope we don't have any more on top of that. But
how has this latest outbreak in the Rantoul area affected the local healthcare system? Last time you'd mentioned, we haven't needed to surge. Are we anywhere near?
So far, we're still doing good at the hospitals. We still only have 6 people who have been hospitalized. So that is good. It's always a concern. It's always a concern when you start seeing a lot more cases, because that's just makes it way more likely that you're going to have hospitalizations or other problems. But so far, so good. There's a lot of numbers we keep track of all the time, and that certainly is one of them.
Thank you. That's all my questions.
Okay, thank you. I believe that's the end of our questions. So just a couple last notes that we always like to make. There's always information about the local response and local resources at champaigncountycovid19.org. So anyone watching who's interested in more information can go there. And also for all of our residents, 211 is a great resource. 211 is a service provided by the United Way of Champaign County. You dial 211, you get hooked up with a trained specialist who can help you sort through the resources that are available if you're seeking any kind of assistance. So we like to get that out there too. That will conclude our news briefing for this week. Thank you all very much for attending. We appreciate it.
Thank you.